Hey, my sleepy friends. Today we're going to talk about options. Options are great, but if you don't know what they are, they can be a bit overwhelming. So when you're in your Dynaflex, Dynafusion portal and you're submitting a case, you're going to see some available features and options that we're going to discuss here today. So the first one is the Dynaflex manufacturer warranty, the dorsal, the tap, and the Herps device is going to come with a 1-year manufacturer warranty, but you do have the option of extending the milled device warranty to 3 years. So that covers manufacturer's defects. It does not cover your dog chewing it, patients losing it, patients getting dental work, needing relines, and that kind of stuff. So that's the first option. The other option you're going to see is shorten lingual acrylic. So what that is, if you can see it here, we do scallop the lingual surface to give the patient more tongue space, which is a fantastic option. They do still go down into the undercut, so we're not actually shortening the device on the lingual surface, but just rather giving them more room by scalloping it up here. The other one, and that one is no additional fee to do that. So when you select that, that's a great option that's not going to cost you. We can add reinforcements. So what the reinforcements are would be like I don't know if you can see it on here, but it's more of a mesh reinforcement around the hardware. So that helps to prevent any breaking from the patients putting too much use on the device, moving around too much in their sleep. So that'll help reinforce it. That does come at a fee. And if you want to know what the fees are, just send me an email and I can send you the fee schedule. We can open the interior to allow tongue space. This is one of my favorite options here. So what that means is you have this little opening in the front so the patient can still breathe with the device in if for some reason they cannot breathe through their nose. It just gives a little bit more of an opening, gives them a little bit more tongue space there. Fantastic option and one that I absolutely love. We can wrap the distal of the last molar. So we all know that devices can cause tooth movements. With the tooth movements, that's back in the day when people would use ball clasp and they wouldn't wrap the distal of the last molar. So now we wrap the distals of the last molar. If you want us to, that is an available option. That will help keep the teeth in place, so therefore they're not going to be shifting as much. Now, however, if they have thirds, you're not going to be able to really wrap the distals unless they have a lot of room back there, but they probably won't. So you can ask me ways of preventing tooth movement in that situation. Just send me an email and I'll be more than happy to walk you through it. We can also add an anterior platform on the oral appliance to disclude the posterior teeth. So that's what you see here. So that would be more so if patients have issues with TMD and you want to change the focal point up here instead of back here where they're not putting so much pressure on that joint. Sorry, it's a little bit blurry. Let me zoom in a little bit more. It's right here, it's that little button there. So that is an additional fee, but we can do that as an option if you wish. The other one is the posterior pads. So the posterior pads would be what they also call tripoding for the tap devices. So here we have the tap. The tap should not touch in the posterior section. However, we can put a little acrylic bump right here in the posterior area, and that will help stabilize the patient's bite a little bit more. So that option does come at an additional fee. And again, if you want to know the fees, I can send you the fee schedule. The last option on here, and it is my absolute favorite, is the elastic hook option. So that one, you can put that on the devices, and each device that has this option selected will come with a bag of orthoelastics. What that does is it helps to keep the patient's mouth shut. So when they're asleep, they're not going to fall open, they're not going to mouth breathe. So it does help the device work much better with promoting nasal breathing, and it helps keep the O2 levels up. So I try to have that option on every device that allows opening. So that would be the dorsals and the Herps devices, and it's fantastic. So those are my favorites. I would say my 4 favorites would be the shortened lingual acrylic, the hooks for elastic, wrapping the distals of the last molars, and the open anterior space for more tongue space. So those are my favorite options. And now when it comes to liners, you also have the option of the thermoplastic liner. So that is the remoldable chair side liner. You just put it in some hot water, and we have specific instructions on that too. You put it in hot water for a few seconds, it's gonna turn clear. You put that back in the mouth and it remolds to any dental work. You can add to the material if you wanna tighten the device a little bit in certain areas. It's a fantastic option. So on all of my devices that I've made for my patients, I've tried to have the AccuFit liner on there because it gives me total control of how this device is going to fit in the patient's mouth. You can also just use the straight milled lining option. So this is going to hold up a lot longer, but if you have to have any dental work done, you will need to do some acrylic work to that. So the other options that you can choose would be well, as you know, every Dynaflex case comes with an AM aligner, or you have the option of purchasing a milled AM aligner. So this one here is fantastic. We make it based on the bite that you send. We articulate it and fabricate this. So it's a wonderful option if you don't want to have to make these chair side. And then don't forget about the MandaTrack. The MandaTrack is another fantastic option for your patients. This is an adjunctive therapy to the AM aligner, so it's not meant to take the place. They're totally different. This is not a morning occlusal guide. However, this can reseat the condyles. It helps the patient brux less, and it does a lot of really cool things. So it helps tone and tighten the airway. It can help any muscular deviation or deflection that your patient's having, help with oral facial pain. So those are our options. If you have any questions, please feel free to email me at cindyh@dynaflex.com. Talk to you guys later.